I'm going to be talking about the findings from a scoping review, which looked at how well Cochrane reviews are incorporating non-randomised studies of interventions. So this scoping review was a real team effort. All the authors work for the Cochrane Cochrane executive team. 4 of the authors are from the Cochrane Method Support Unit, including myself. And then we also had 2 colleagues from the Cochrane Central Editorial Service who work as quality assurance editors. Therefore, this team had a wide range of methodological and statistical expertise. So this project didn't have any funding, and all the author team are employed by Cochrane. We have recently submitted the scoping review to an academic journal, and it's currently under peer review. So for this session, I'll briefly introduce what non-randomised studies are, why they are used, and how they are important in Cochrane reviews. This will then lead me to providing the rationale for conducting this project. I'll then briefly discuss the methods and the findings of this scoping review and talk about lessons learned from this project and what the next steps might be. There'll be plenty of time for questions at the end, so do keep posting your questions throughout my talk. I'm really interested to hear from those who have been involved in conducting systematic reviews which have involved non-randomised studies. So any thoughts and feedback on the findings from our scoping review would be really welcome. So firstly, I have a little poll question for you all to ask. So I just want to know a little bit more about your role. So most people, over half of the people, are researchers or systematic reviewers, which is good to know. Yeah, and kind of some spread across the other categories. So yeah, thank you for answering that. And I've just got one more. Oh, sorry. We have one more question as well to ask you. So I just want to know how familiar you are with non-randomised studies of interventions. So if you know a lot about them and why they can be important, if you've got some understanding but would like to know more, and if you're not very familiar with them. Over half of the people have some understanding but would like to know more. Yeah, so thank you for answering those questions. So now I'll just briefly remind everyone about what a randomised control trial is. So these are commonly used in Cochrane reviews assessing the efficacy of interventions. They involve randomising participants to either an intervention group or a control group, and some trials will have more than 2 groups. So these groups are then followed up for an amount of time, and the outcomes are generally measured at the end of the trial or at multiple time points along the trial. And then the results of each group are then compared. So if randomization is successful, then the prognostic factors should be balanced at baseline to avoid confounding. Prognostic factors include things like severity of disease, age, BMI, ethnicity, etc. So therefore, RCTs are usually referred to as the gold standard in terms of study design. So what are non-randomised studies of interventions? So in the Cochrane Handbook, Chapter 24, they are defined as any quantitative study estimating the effectiveness of an intervention that does not use randomisation to allocate units to an intervention group. So why would someone be interested in a study which is non-randomised when in the previous slide I said that RCTs are the gold standard? So non-randomised studies are really important in providing valuable insights into the real-world performance of interventions. They can be important in answering questions about the long-term effects of a treatment or about rare outcomes, such as rare adverse events. These can be difficult to study in RCTs, which generally have a shorter follow-up time period. In some research areas, it may be unethical or unfeasible to randomise participants. Therefore, non-randomised studies might be the only option to provide data on the effects of an intervention. So, for example, here is a common study design of a non-randomised study assessing the effect of an intervention. So this one would be labelled as a prospective cohort study. So in this example, the researchers may be looking at the effects of an educational programme to stop people smoking. So volunteers are recruited who are smokers, and this is the cohort. And then the researchers would collect data about the exposure to the intervention, so whether they participated in the educational programme or not. They would also then collect outcome data, so the outcome data that they're interested in. So for example, in this case, this could be incidence of lung cancer, and then they would assess if there is a link between the intervention and the outcome. So when I talk about non-randomized studies, this includes all study designs where participants aren't randomized. So study labels are commonly used to describe different types of non-randomized studies. And they include terms like cohort, case control, cross-sectional. And in the Cochrane Handbook, quasi-randomized studies are actually considered to be non-randomized studies because the way in which the participants are randomized isn't considered truly random, such as they might randomize on date of birth or order of recruitment. So one of the biggest challenges of including non-randomized studies in a systematic review is that these study labels aren't always used consistently, and sometimes they might mean different things. Therefore, the Cochrane Handbook encourages the use of study features rather than study labels when considering which types of non-randomized studies to include in your review, and also when considering which types of study designs are going to be analysed together. So in chapter 24 of the Cochrane Handbook, they refer to a checklist of study features, which is from a paper by Reeves et al. 2017, and it has 7 questions. Here are the first 2 questions on the checklist. So the first is asking about allocation of individuals or clusters of individuals, and the second is about when the outcome data was available. So by completing this checklist, it allows you to produce a list of study features which can form your inclusion and exclusion criteria, and it can also help you to decide which studies are similar enough to be combined in an analysis. So why did we decide to conduct a scoping review looking at Cochrane intervention reviews which have included non-randomized studies? So the main reason was due to the recent launch of Cochrane's scientific strategy. So the strategy details 4 research priorities: maternal, newborn and child health, multiple chronic conditions, infectious diseases, and climate change and sustainability. It also highlights 4 commitments to innovate in methods, promote health equity, collaborate and evolve, and champion research integrity. So we believe that evidence from non-randomized studies of interventions will likely contribute to some of these areas where it may not be possible to answer research questions using RCT evidence alone. Therefore, we aim to conduct a scoping review to see how closely Cochrane review authors are adhering to Cochrane Handbook guidance when incorporating non-randomized studies of interventions. And then this will hopefully identify the areas which authors may need further guidance and support. So our main areas of interest in the scoping review were to see what percentage of recent Cochrane reviews included or planned to include non-randomized studies. So we chose to look at 2 separate years, 2019 and 2023. So we chose 2019 as this was in line with when version 6 of the Cochrane Handbook was published. We could then assess how adherence to guidance has changed from 2019 to 2023. We also wanted to know some simple characteristics of the reviews, such as how many RCTs had they included, how many non-randomized studies were there, and also did the review authors plan to include non-randomized studies in their protocol. We also wanted to look at how well authors are following Cochrane guidance. So are they justifying the inclusion of non-randomized studies? Are they specifying potential confounders, etc.? We were also interested in how non-randomized studies were analysed. So were they included in meta-analysis, and was this together or separately from RCTs? How were they handled narratively? Did they use the SWIM reporting guidelines? And SWIM stands for synthesis without meta-analysis, which I'll explain a bit more later on. We're also interested in how they were included in summary of findings tables, which are mandatory in Cochrane intervention reviews, and was grade used to assess the certainty of evidence. Finally, we wanted to know more about the risk of bias tools, and were they using the recommended tool in the handbook, which is Robin's Eye. So I'll briefly discuss the methods. So we uploaded our protocol onto an online repository in March 2024, and conducted a search in the Cochrane library. So we're only interested in reviews published in 2019 or 2023, and these were only Cochrane intervention reviews. So we excluded other types of reviews such as diagnostic test accuracy or overviews of reviews. The reviews must have planned to include non-randomized studies. So this could be either formally or informally, which I'll describe a bit more in detail later on. And we also made a tricky decision regarding quasi-RCTs. So I mentioned earlier that these are actually considered non-randomized studies in the Cochrane Handbook. However, since all the authors on the scoping review have experience with Cochrane reviews, we knew that in general, Cochrane review authors commonly handle quasi-RCTs in a similar way to RCTs in the analysis and in the risk of bias assessments. It would have been really difficult to distinguish which reviews included quasi-RCTs, as it's not always clear from the methods. So they might have said we included RCTs, but they also meant quasi-RCTs. And it would have involved kind of going back to all the individual studies and trying to figure it out. So we decided it's kind of out of the scope of this review. So therefore we excluded any reviews which only plan to include quasi-RCTs and not any other types of non-randomized studies. So all reviews that were published in 2019 or 2023 were exported from the Cochrane library into Rayon software. Each review was screened by 2 reviewers in duplicate. We piloted data extraction form, and each data extraction was conducted by 1 author. Any uncertainties were discussed as a team. The data extractions were then added to an Excel spreadsheet to produce descriptive statistics, and figures were created in RStudio. So next I'll discuss the main results of the scoping review. So we identified 937 reviews published in the Cochrane library. So this was 531 from 2019 and 406 from 2023. So after screening, we found that 87 of these were eligible. So 60 from 2019 and 27 from 2023. So I've put the percentage of reviews at the bottom. So this shows the percentage of reviews which included non-randomized studies in that year. So you'll see in 2019, it was 11.3%, and in 2023, it was 6.7%. So there's been a reduction in reviews, including non-randomized studies. We also extracted data on which Cochrane review group these reviews were published under. So this figure here shows the review groups which have 3 or more reviews published. So the group with the highest number was the gynecological, neuro-oncology and orphan cancers group, and public health, hepatobiliary, effective practice and organisation of care, and infectious diseases were also had high numbers of reviews as well. So across the 87 reviews that we included, there was 583 RCTs and 763 non-randomized studies included. So the mean number of studies of all designs per review was 15, ranging from 0 to 182. The mean number of RCTs was 7, ranging from 0 to 41, and the mean number of non-randomized studies was 9, ranging from 0 to 173. We found that 9 reviews included 0 studies, so there was no RCTs or non-randomized studies, so these were empty reviews. Out of these 87 reviews included, 72 planned to include non-randomized studies for all outcomes, 13 for only adverse events, and the remaining 2 for specific outcomes. 82 reviews specified to include non-randomized studies in their protocol, and the other 5 actually changed their protocol methods to include non-randomized studies. 28 reviews were updates. So if we look at some of the areas which are recommended in the Cochrane Handbook, the first is regarding justifying the inclusion of non-randomized studies in the review. So to include them in addition or instead of randomized studies, this should be justified in ideally both the background and method sections. So we found that only 36 reviews out of the 87 actually gave a justification for why they were including non-randomized studies in their review. So that's only 41% of reviews. It did increase slightly from 2019 to 2023. The handbook also states that review authors should list any potential confounders in their protocol. So this is especially important for the risk of bias assessments and is one of the requirements of the tool Robin's Eye. We found that only 16 reviews, so 18%, did this. It did increase from 2019 to 2023, but it's still very low in 2023, only 33%. So at the beginning of this presentation, I discussed about using study features instead of study labels. And then we found that only 41% of reviews describe study features in their methods section. So the description of study features did vary quite widely. So most of the reviews use study features in addition to study labels. So they would list the study designs they would include, but then would also describe some of the features for inclusion. None of the reviews referred to the checklist by Reeves et al. 2017 from the Cochrane Handbook. And we actually found that 16 reviews didn't use any study labels or study features to describe the types of non-randomized studies they would include. They would quite commonly say, we included non-randomized studies, but not say anything else, or we included observational studies with no further detail of what this meant. So finally, since these study designs aren't randomized, it's important for the statistical analysis that review authors should consider adjusting the results for any potential confounders. The trial authors should consider adjusting the results for any confounders. Therefore, in a systematic review, authors should prioritize extracting appropriately adjusted effect measures and ideally specify what they would expect the study authors to adjust for. So we found that only 29% of reviews stated that they would prioritize adjusted effect measures in their protocol or methods section. So there's no real change from 2019 to 2023. So when we looked at how Cochrane reviews included non-randomized studies, we found that 16 reviews didn't formally include them. So I mentioned this briefly earlier. So when we say formally, we mean that they were actually listed as included studies in the review. So they would have a characteristics of included studies table, and they would be included in the total number of studies in the review. However, we found that some Cochrane reviews search for non-randomized studies, but they didn't actually include them as included studies. So they would sometimes discuss the results in the discussion section of the review or as an appendix or an additional table, even though they stated that they planned to search for non-randomized studies in their methods. So we decided to include these types of reviews as we wanted to show the different ways non-randomized studies are currently included in Cochrane reviews. So in addition, we found that 23 reviews stated that they found no non-randomized studies which met their inclusion criteria. Therefore, in the remaining 48 reviews, we found that 24 had included at least one meta-analysis including non-randomized studies, in addition to a narrative summary of the data. There were 22 reviews that only included a narrative summary of the data, so there was no meta-analysis. And there was 2 reviews which actually didn't include a meta-analysis or narrative summary of the data. So this meant that they included the non-randomized studies, but didn't actually report any of the outcome data from the studies. So of the 24 reviews which conducted a meta-analysis including non-randomized studies, we found that 9 stated using adjusted measures in their meta-analysis, but only 5 stated the covariates which the analyses were adjusted for. So in the other 15 reviews, it was either that they'd used unadjusted effect measures or it was unclear what they had used. We found that 6 reviews had a meta-analysis which combined both RCTs and non-randomized studies together. So this is actually discouraged in the Cochrane Handbook, but there is some literature which does support this approach if it is done properly and is justified. We found that none of the 6 reviews justified their approach to combining RCTs and non-randomized studies together. Also, only one of these reviews reported that they had included adjusted variables. In the other 5 reviews, it was either unadjusted that was used or it was unclear what was used. So when looking at how reviews handle different study designs for non-randomized studies, we found that 6 reviews had included a meta-analysis which analysed different types of non-randomized studies separately. For example, they would have a meta-analysis which included cohort-type studies and then another meta-analysis which included controlled before and after studies. But we actually found that 9 reviews had combined different types of non-randomized study designs together in the same meta-analysis. So we also looked at how Cochrane reviews narratively summarise data which couldn't be included in a meta-analysis. So this included single study forest plots. We found that 46 reviews narratively summarise the outcome data from non-randomised studies. Of these, 17 reviews attempted a narrative synthesis. So when we say narrative synthesis, we refer to a method of synthesizing the results, which isn't just narratively describing the results of each study separately in the text. So we followed the guidance given in Chapter 12 of the Cochrane Handbook, which provides guidance on undertaking synthesis using other methods, and also the SWIM reporting guidelines, which SWIM stands for Synthesis Without Meta-Analysis. The types of synthesis methods included were producing structured tables of narrative data, harvest plots, and direction of effect plots. We found that only 3 reviews published in 2023 referred to SWIM guidance in their protocol or method section. So the SWIM guidance was published in 2020, so we wouldn't have expected any reviews published in 2019 to refer to it. So we also looked at how Cochrane reviews were incorporating evidence into their summary of findings tables. We noted that only 5 reviews mentioned how they would handle different study designs in their protocol. So 2 of these stated that they would provide outcome data from RCTs and non-randomized studies on separate rows. 2 stated they would produce separate tables, and 1 review stated that they would only include RCT evidence in the SOF tables. We found 38 reviews which had included non-randomized evidence in at least 1 summary of findings table. So we were interested to see how reviews handled outcomes where they had both RCT and non-randomized study evidence. So we found 20 reviews which had presented RCT and non-randomized study evidence for the same outcome. 11 had created separate rows, 5 had created separate tables, 2 had used footnotes to report the data for non-randomized studies, 1 had used a narrative summary at the end of the table, and 1 had used the comments box. So there's currently no published guidance on how to handle outcome data from different study designs in the summary of findings table. So this is probably why we're seeing so many different approaches. We also looked at whether the evidence from non-randomized studies had a grade assessment. So we found that 37 out of the 38 reviews with an SOF table had provided grade assessments, which is encouraging. However, they were mainly very low certainty, and this was mostly downgraded for study limitations, so high risk of bias, mainly due to confounding. 2 reviews had upgraded evidence for non-randomized studies, either due to large effect or because of a dose response gradient. So finally, we also extracted data on the risk of bias tool, which the review authors plan to use. So this table is showing the different tools. The most common tool was Robbins I. So this was included in 29% of reviews, so 20% in 2019 and 48% in 2023. So the numbers have definitely increased. The next most common was the EPOC tool. So this is from the Effective Practice and Organisation of Care Cochrane Group. This was used in 23% of reviews, and it was a similar percentage in both years. Interestingly, 20% of reviews didn't plan to use any risk of bias tool for non-randomized studies. And this was mostly in those reviews which didn't formally include non-randomized studies. 15% of reviews used risk of bias 1 for RCTs or adapted the tool. 11% used the separate EPOC tool for interrupted time series studies. 10% used Newcastle Ottawa, but interestingly, this wasn't used by any of the reviews in 2023, and 11% used some different tools. So what can we conclude from this project? So we have seen that the number of reviews published in 2023 compared to 2019 has reduced, as well as the number of reviews which have included non-randomised studies. So potential reasons for this are to do with the closure of many of the UK review groups due to loss of funding. And also we think potentially that the focus on COVID-19 pandemic reviews might have been the reason why there was less non-randomised study reviews published. Our main finding is that in general, adherence to Cochrane Handbook guidance was low. This included not justifying why they're including non-randomised studies, too much focus on study design labels, not prioritising adjusted measures, and not listing potential confounders in their methods section. So when a meta-analysis was conducted, it was really difficult to determine if adjusted effect measures were used, and if they were, what were they adjusted for? Also, when review authors combined RCTs and non-randomised studies together in the same meta-analysis, there was no justification for this. In narrative summaries, SWIM reporting guidelines weren't generally followed. Narrative syntheses were less common and the methods did vary. We did note that many reviews were limited by the low number of non-randomised studies included, so it was common to see single study forest plots or narrative summaries of single studies because that was the only evidence available for certain outcomes. So in the summary of findings tables, most reviews didn't say how they would handle different study designs in their protocol. There was different approaches to handling evidence from RCTs and non-randomised studies. Grade was used in nearly all of the reviews, which was good, but it was generally, the outcome data was rated as very low certainty. Robin's Eye was the most common tool used, but it's still only about half of the reviews in 2023 used it. So from this scope and review project, we would like to see more guidance on how to incorporate non-randomised evidence into Cochrane intervention reviews. We think that better signposting to already available guidance is needed, as there is quite a lot of evidence, guidance already out there. It might be that the development of guidance in different formats is needed. So it could be that there's more interactive tutorials or webinars which people can listen to. It's also really important to promote any upcoming guidance within Cochrane and the wider community. So there is some upcoming guidance from Grade on how to incorporate non-randomised and randomised studies into summary of finding tables, which is definitely needed. So here are the main resources that I've used to develop this webinar. So firstly, definitely look at chapter 24 of the Cochrane Handbook, as there's some good guidance there. Chapter 12 is really good for talking about different ways to synthesize data when a meta-analysis isn't possible. And this can be used alongside the SWIM reporting guidelines. Robin's Eye tool is available at the riskofbias.info website, and chapter 25 of the Cochrane Handbook also describes this tool. Finally, there are some reporting guidelines available for meta-analyses of observational studies, and these are called MOOS guidelines, and these were published in 2021.